Hey everyone, group dynamics are complicated. Think about friend groups and how many different aspects of feelings that come up when you're in a friend group, how many different ways of relating to different people there are. Think about families and the multiple ways in which one part of the system impacts the entire family system as a whole, as well as each of the individuals in the family. Think about therapy groups. Not only do we have to pay attention to the dynamics between and among the individuals, but we have to pay attention to each of their dynamics to us as a group leader. And as within every family, every child has a different relationship with the mother, the father, or the caregiver. So every member of a therapy group has a different relationship to the leader. And all of this is played out in group therapy, from sibling relationships to peer relationships to feelings of competition and favoritism and authority and so much more. Not only are we addressing common struggles within a group treatment environment, whether it's addiction, anxiety, depression, grief, and so on, but also the transferences and countertransference that comes up. So we're going to talk about all things group today, and we're going to do it with Dr. Ray Blanchard, who is an assistant professor and clinical coordinator in Molloy University's clinical mental health counseling program. He's also a bilingual clinician and supervisor with 10 years of experience working with children and adolescents in New York City schools. And he earned his PhD in counseling from Montclair State University, specializing in school mental health and LGBTQ issues. If you want a lengthier bio on him, you can check out the podcast description. But welcome, Ray. And I'm calling him Ray because he's my colleague at Molloy University, although he's in another program. Hey, 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 Ray.
Thank you so much, Amy. It's wonderful to be here. I really appreciate the opportunity.
Yeah, I'm totally looking forward to this discussion because I've run some groups in the past and continue to do so here and there, and would love to educate our listeners about what goes on, not just in the groups, but behind the scenes, what we have to contend with. And I think one of the things we've talked about also before we hit the play button, the record button, was also considering the classroom as a group and the dynamics that come up within the classroom, because all these things that I was just talking about, right, the transferences and the things that students are sitting with in regard to speaking up, not speaking up, right, who we call on, who we don't call on, who we enjoy hearing from, who we don't enjoy hearing from, all of that is part of the group dynamic as well. But let's start at the very beginning. So tell me a little bit about putting together a group and what you consider and how you go about creating a group.
Yeah, that's a really great question. And I love how you brought up, our beginning piece, right, of thinking about the classroom as a group. And it happens in so many different settings, ranging from schools to hospitals to outpatient mental health settings. And when I think about setting up a group in those settings, is this idea of what are the needs? Who's our population of focus? That's always where I begin. Especially having worked in the schools, they were always asking for groups left and right. Oh, can you run an anger management group? Can you run a social skills group? Can you run an emotions group? And they're all great topics, but I always think about first, who are our participants, right? And thinking, what are the dynamics? How does gender, race, their language abilities, their developmental age all play a part? Because that's going to have a big impact on the group setting. And it's also going to vary from place to place as well, where I think about, in a hospital setting, they may just say, here's your 6, 7 clients, run a group. Whereas maybe an outpatient or school based, you might be able to interview each participant and have an idea of who they are, why they want to be a part of the group, things like that. And so in the beginning, it's really just thinking of who are our folks. And then from there, you start to put what I consider like the puzzle pieces together. You're thinking about the day and time of when it's going to be run, what kind of activities you want to bring into it. If you want to do more of like a skills based group, or is it more psycho ed, right? Are you doing more of like the leadership and facilitation? Because I think for us as group leaders too, there's so many hats that we wear in that process that really make it an enriching experience. And then of course you can also make it therapeutic, right? Of really thinking, how are we delving into those emotions and making the connection. So those, I mean, those are some initial ideas. I'm curious, like your thoughts as I like start to bring this up.
No, I think that those are very important. It's interesting. I've never run a group that I haven't pre-screened. I can imagine being in a setting where they say, well, just run a group. If it depends, of course, on the type of group. If you're running a
Right.
psychotherapy group, you want there to be common themes and people who can manage a group dynamic, even though that's part of the process too, and helping them through that when they're in the group. But
Sure.
unless it's a psychoeducational group about something that you're teaching, or developing skills, as you mentioned, right? Anger management, where there's kind of somewhat of a programmatic aspect to it. I don't know how you can run a psychotherapy group without doing pre-screening. So now that's my question to you. Have you done that? And how does that work?
Yeah, so the way that I've seen in my own clinical experience, either me facilitating or also colleagues facilitating psychotherapy groups, was, the common theme was their diagnosis, which, can be helpful in some ways, right? Everybody has a diagnosis of ADHD, or maybe they have a mood disorder or something, to that effect. Maybe they have a trauma history, things like that. Um, so I've seen groupings that way. But when it comes to the dynamics, you want to really then think about how is that going to impact cohesion? How's that going to impact function? Are they going to show each week, right? Do they have a history with each other? Um, Different things like that. And that's hard to know without the pre-screening, but I have seen it done. Um, and for the most part, thankfully, it's been fairly successful. From both my own clinical experience and with colleagues. I think about a group that I ran for a group of men who were diagnosed with HIV and hepatitis C. And it was already an established group that they said, Ray, take over, but we want it therapeutic. Because before it was more supportive, maybe some psychoed here and there. Um, they had a history together. And at the same time, I didn't know their dynamics. So I remember like in the first group with them, I said, how can I join your group as the facilitator, right? Knowing that I'm the outsider coming in to an already established group. And then
Hmm.
when I talked about making it therapeutic, they were like, well, what does that mean? We've just been talking. But I said, hey, let's bring in some of these different skills. Let's think about how we're managing our emotions, knowing various diagnoses, or that we're losing friends to, HIV, AIDS, things like that. And it was a really profound experience because while there was some hesitation, right, when I think around like the group formation, or even when you think about group stages, it's thinking about how we as the facilitator can also enter that space as well.
Yeah, and you entered it beautifully. I mean, that was
Yeah,
a great thing to put out there to the group. Like, and it's also kind of giving them ownership. This is your group, right? I'm kind of an intruder right now because it's already been ongoing. So let me know what you need and let me know, how we can make this the most helpful because it sounds like it was being run as a support group.
exactly.
And
Yeah.
you wanted to also like develop coping skills and offer them something more concrete. I'm interested in really getting into psychotherapy groups. Can we talk about that?
Sure. Of course,
Okay.
absolutely.
All right, let's do it. So I want to know about the psychotherapy groups that you have run and the types of dynamics that you're paying attention to, because I think that no matter what the topic is or commonality, right? I had said in my introduction, depression, anxiety, grief. Now you're talking about hepatitis C and HIV. Whatever the commonality that brings the members together, it doesn't matter. There's always dynamics within the group, no matter what the subject matter is. And so, what have been some of your experiences managing, paying attention to those dynamics, highlighting it, knowing when the time is for people to work on, hey, you were just relating to Nancy in a certain way, or, rather than the support group, like, does anybody else experience this? Does anybody else feel this way? What have you done when this happens, right? This is now more using the transferences to do some growth and healing, right? So whatever's going on usually outside of the group or outside of the therapy room, excuse me, whatever's usually going on inside is a replication of what's going on outside. So to be able to manage all those dynamics, right, with 8 to 10 people, 6 to 10, depends on the size of the group, it's a lot going on, right? Sometimes it's hard enough to do that one-on-one when the transverses come into play. Tell me
Exactly.
about how you think about that, manage that.
Yeah, I mean, it's an interesting experience, and that's one thing that I love about group as a therapeutic intervention, because it's not just the facilitator who is, facilitating the group, right? It's about the membership. It's how the members are interacting with each other, all of that. And I'm more of a structured group leader myself, where I would say I ascribe to a heavy cognitive behavioral therapy or dialectical behavior therapy, a group approach where let's structure our sessions. How's it been since our last group? Here's our activity or our thoughts for the day, our interventions for the day. Let's save that time for processing. And then also kind of close it with some sort of like reflection, maybe going around the room sort of ordeal. That's generally the approach I take to my groups. Um, but with that, as much as I can have a lovely plan for that day, maybe one of the group members comes in having a really bad day, or something happened in the parking lot to two members coming into the session. And now it's brought in, like you were saying, like the outside is brought to the inside, right? Um, and so that could throw off the group, the group dynamics, but also the group structure for the day. And so generally when I'm doing like one of the things I love to do is like a welcome check-in, with that idea of how's things been, or what's everyone feeling today? Or what's one reaction you've had since the last time we met for a group?
And when
Different
you
things
do
like that.
that, sorry to interrupt, but when you do
Please.
that, are you going around and asking every person, or are they just pitching in if they feel they want to say something?
Generally, so from my structured approach, everybody answers. Now, folks can pass if they really feel like they aren't in the spirit of sharing,
Right.
but it's something I also take note of. Like, okay, maybe Susie and Eric didn't want to share today, but let me pay attention to to them while we're in the group. What's happening there for the two of them. Um, are they eventually going to share? Are they more reserved? Things like that. And that's where then when I'm looking at group dynamics, I'm looking at how are folks interacting with each other? Who's sharing the most? Who's sharing the least? If somebody shares a poignant point, how can I facilitate and say, okay, how might we support, Eric in that journey of, utilizing his I statements when his anger gets, really difficult, different things like that. Um, and so, I'm always kind of like scanning the room, thinking about, all right, what's happening? Who's looking down? Um, who's shaking their legs or different things like that. Um, all of that comes into play, right? That body language is really important. And I also think about it too. So that's me kind of like describing it from an in-person sense, but I've also done groups virtually, especially during the pandemic and things like that. And I feel like on Zoom, you get an even bigger picture into how they're interacting because you can tell when they're texting, when they're looking on the screen at other things, and it's finding a way of how do you pull them back into the group, perhaps gently calling them out on it. Like, I'm noticing that, you're often looking down, that you're laughing. I'm wondering, are you on your phone? How could we be more present? Right. So it's kind of finding that way of inviting them while gently calling them out on it. Or other group members doing it themselves. Right. And that always, I think, is an interesting dynamic too, when the group members start to call each other out on things where shaking of the legs or oversharing too much, because then that could also tell about perhaps the transference that's also coming up, within the session as well. Does that make sense?
Oh, it makes complete sense. And it's so funny that your last example was the example that just kept coming into my mind about the person who monopolizes. And so when you're going around, right, that it's easy to expect that. And then if you expect that, I suppose you can manage it. But just as an alternative viewpoint, it's interesting. I don't do the check-ins because I think that this stuff can come up anyway. So that if you were to say, for example, so who wants to start today? and somebody, wants to start, but it's that same person every week when ask that open-ended question to monopolize or not be sensitized to other people's needs, right? And so that same dynamic comes out, but it's a little bit more organic. And then I can make room, also help make room for other people. You know what? We haven't heard from Liz for a while, or, in the past couple of weeks, you've been kind of quiet. Do you want to start off today? So it's kind of interesting, right, to see two different styles that can lead to the same thing, right?
Hmm.
But in a way, I guess I've been trained with like start where the client is. And so you're trying to start where every single client is. And I'm trying to start with let's see who feels, not necessarily has, but feels the most pressing issue, right?
Yeah.
And it's curious to see what roles people take on as well. So the person who's more of an observer, maybe they don't have to speak. That's okay. Maybe they're getting a lot out of hearing other people. But is
Hmm.
that a reflection of their role in the family? Is it really helpful to them or something they've been conditioned towards, for example?
Right.
Right. And so that's what I'm always kind of looking out for or wanting to point out. So a lot of times people don't come to groups expecting that their behavior, actions, or inactions are going to be part of the treatment, part of the process. It's like, oh, I thought we were just here to talk about grief or, right? Not about the dynamics and what can we learn about the way we relate to people based on what's happening in this room.
Yeah, absolutely. I mean, you bring up some really great points there too, because I think about how you can then join members together, right? I'm noticing that you're having a really strong reaction to what, so and so is saying. Tell me a little bit more about there. Did anybody notice when, Ray did X, Y, and Z, right? Of bringing that into the session? Because then I also think too of how we help like process and work through those dynamics and how that could also to your point around like self-awareness, right? Is the monopolizer aware of that they're taking over every time, or can we also bring in those group dynamics to explore that, that Susie always starts us off, but Eric is always silent, right? Different leadership and participants like that.
Right. And so that's observing roles or behavior within a group.
Right.
But if we talk about it from a transferential point of view, do you ever then get to, how this is connected to how they are, either in their family or outside of that environment? And how does that go?
Yeah, absolutely. When I think about transference in the group, right, we're thinking about how past relationships or current, right, are being brought into the space. And what are those, unresolved conflicts that are happening? And so maybe through that, I've seen where I've more so like validated, right, or brought it into the session for folks, and then seeing how the group members also react and help them process or help them talk about it. And then it becomes, in some ways, both therapeutic and supportive, right? Because it's therapeutic because they're talking about that conflict. Maybe they're talking about where it comes from, but then they're getting the support from the members in, you can do this. What if you tried it this way, right? So they're also getting some of those like points that we as therapists we don't necessarily say try this, right? We try to help them get to
Come
that
to it
path
on their
for
own.
themselves.
Yeah.
Yeah. Whereas in a group setting, the other member might just say, hey, it's time to leave them, right? Or it's time to end that relationship. um, and how could that also be helpful and healing in its own way? um, and at the same time, right, so that's one way where group members are coming together to support one member. But then I also think too about the conflict that can also come up between members and how, one may say, oh, this reminds me of the fight that I had with my partner this week, or, the relationship that I have with my kids, or, when I lived with my mom, or things like that. And then also too, how to then bring that together. And so I think, for me, from like a cognitive behavioral lens, you're really, I'm big on like the cognitive triangle, right? How our thoughts, feelings, behaviors all interact. And so I
Love it.
encourage the members of all right, what's coming up for folks with your triangle? What do you notice how you're reacting to what's being said in the space, different things like that. And then facilitating that discussion. Of yeah, that reminds me of this person that I knew when, right? And then thinking, okay, how do we then work through some conflict resolution with that? What
Yeah.
might it be like to let that go or to give voice for maybe the first time?
Do you ever have them practice that in the group? Like they're in conflict with somebody, whether it's outside of the group or inside the group. What do you want to say to them?
Absolutely. And something that I'm big on too is the idea of like I always have this like hand gesture in group where I'm like pointing to the center in front of everyone. And I'm always like, okay, who's in the center with us now? So that folks can kind of like envision it, right? Maybe it's a little gestalty, right? If you think about like the empty chair, but not so much using the empty chair, but just envisioning that whatever that topic, that conflict, that person, that situation is present in the room, and then have them kind of like talk it out loud with each other. And I've seen it work really well because they're like, oh, I never thought I could say it this way, or oh, I didn't really realize how angry I was when or things like that. And it's something I remember learning from a former professor of mine, always like centering in the group. And I always found it to be really interesting because it's so powerful to just imagine like having that really in the space with us.
Mm-hmm. Mm-hmm.
Yeah.
I think that empty chair thing was used a lot by eclectic practitioners, whether it's role playing or whatever you want to call it, the empty chair, right? And it can be
Right.
a very powerful tool. I'm wondering about all the different members within a group's transference to you. So that's a lot to manage, right? Everybody who has their
Right.
own perception of you, expectations of you, love for you, dislike or hate for you. And it's all happening at once. You're paying attention, but not at every moment, right? We know that's not happening at
Sure.
every moment. But do you have an example of that and how that got played out in group?
Yeah. So like you're saying the members towards me as the leader.
Yeah.
Yeah,
And we'll get
absolutely.
to you towards them, but yeah,
Yeah.
no.
Yeah, absolutely. It brings me back to a kids group that I was running, particularly around anger management. Um, and several of the students or the participants started to see me as a father figure, so much so that um, definitely two of the kids kept referring to me as dad. And I kept talking with them, about what that meant for them, and what they were feeling. And it was interesting because as as they're talking about the relationship that they don't have with their dad. But here's someone who's a male figure listening to them, who's guiding them, supporting them. And then some of the other kids joined in, like, yeah, I see Mr. Ray as a dad too, things like that. And so we talked about like roles and what that could mean and things like that. But it was really powerful too because they started to really implement the skills that were being taught. And they were like, I want to make sure that my mom is really proud of me, or that my teacher is really proud, but then also that Mr. Ray is proud. And I said, well, I'm proud of you, right? And so it's kind of like processing those experiences there where they're trying to do certain skills to a person, right, to make somebody like proud, if that makes sense. um
Um, I'm trying to understand because I'm really interested in the transference piece of them calling you dad, and then how that plays into your countertransference and what your reaction is to that.
Yeah, yeah, no, it's so what was happening there was their transference to me was me looking like a father figure, right? And then also trying to appease, right? Or like make me happy, right? If that makes
Right.
sense. And then
Yes.
similarly, their teachers and their parents and things like that. And then for me, I remember feeling struck in a way of um like, oh, that kind of pulls at the heartstrings a little bit. And I remember going to supervision, talking to my supervisor, like, how does this play out? And she goes, listen, you want to set the boundaries with them that you're the therapist. And what does that mean? And how you are teaching them these skills so they can go out and do it on their own. things like that. And so it was always helpful for supervision, um, for me to process it there. And then certainly continue to set those boundaries. And the kids did wonderful because they were like, yeah, you're Mr. Ray, all of this. And they kind of moved away from the idea because I was like I want to say it was two or three groups where they talked about like this like father figure. Um, and then they moved past it as I started to talk more about, just what my role is and things like that. And then it kind of moved on from there. Does that make sense?
Listen, it makes perfect sense. I think it's very interesting, although I have a different view on it, which is why I love these discussions, right?
Yeah.
With therapists and how we have different styles and different beliefs and different motivations. So my feeling would be, so what? So what if they call you dad, see you as dad? Why is the goal to implement boundaries so that they can see you as who you are, a therapist? This is their projection. This is what they need in the moment. I think sometimes that we feel threatened by that and scared by it and vulnerable and don't want that sense of responsibility. I actually remember now I did a former student of mine did a podcast episode with me, and it was based on his countertransference. And it was that one of his clients said, "You're just like my brother." Well, I'm not your brother, he said, because this was an adult, but he still said, "You're not my brother," because he was very scared of having the client depend on him in that way or have certain expectations and that he'll only be disappointed and the relationship is time limited and right, all of these things. So to me, it's very curious about you and your countertransference to what it may feel like to be seen as a dad or to have certain qualities that they may either fantasize about, idealize about you, or see in you that are very real and 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 want to enjoy that part of you.
Yeah. And it's interesting you bring it up too, because I remember when this group was running, boundaries was a really big part of the therapeutic process, both individually and in groups at the time. Because the students, I remember going to supervision each week, talking about my cases, and they were like, these kids are gravitating towards you. You have to make sure that like they see you as the therapist, right? Because they were calling me Ray or, Mr. Ray, and I'm like, they can call me, doesn't matter. Um, and I remember my supervisor being like, no, boundaries, boundaries. And so that was always infused in me at the time. Because she was like, well, I hear what's coming up for you. And I said, okay. And she's like, boundaries. And I'm like, okay.
Yeah,
This is like early on in my career. I want to say maybe my fourth year practicing,
yeah,
give or take.
yeah.
Um, but it's interesting to like reflect even on it now and to like hear our dialogue. I'm like, yeah, you're right. Like the so what?
Right. So what? You know what? It's so funny because I'm very boundaried. Like I don't self-disclose a lot at all, unless I'm directly asked. And even then, right, I want to understand what significance it has. But to me, this isn't about boundaries. You're not taking them home with you. You're not saying, "Hey, call me tonight to say goodnight." You're just allowing them to perceive you how they do. That's
Right.
it. Right?
Yep. Yeah, without a doubt.
So
Um,
interesting.
Yeah, and I think that's what's always interesting too when I think about working with kids versus adults. With adults, there's a lot of transference and even sometimes countertransference, right? Because I think with adults, the countertransference that could come up is the idea of they're really pushing your buttons. And what is it about them pushing the buttons of maybe they're all sitting in silence, maybe they're refusing, different things like that, right? And what's coming up for me there.
Hmm.
Um, versus with kids, it's more so kind of like how you're saying, like their projection, and then how am I feeling with them saying certain things, right?
Hmm.
Or like I was because I did a lot of trauma work with kids too, and both individually and in group settings, and always tugged at my heartstrings when they would disclose the abuse or the physical traumas, the sexual traumas,
Yeah.
and just how do you then also continue to process that, especially in a group setting? Because I remember doing a middle school, I think they were like a group of seventh and eighth grade students who disclosed various traumas. And this was more like just an emotion skill building, therapeutic group in that regard, like feelings identification, things like that. Um, and when they, talk, when one person disclosed, it kind of like started that cascade effect. And I remember thinking like, all right, like what's coming up for me in the group? And I remember like leading everyone through kind of like a breathing exercise. And I think also at the same time, it was a breathing exercise for me, in full transparency, just, because they just so quickly disclosed. And I was like, again, this shifts the dynamic and also the approach, right? Because now we've developed such cohesion and trust that, um, they felt comfortable to self-disclose that,
Yeah.
and kind of like how that shifts the dynamics too.
And when you say shift the dynamic, shifts it how?
Shifts it more both in how I was going to approach it, right? And thinking, oh, we're doing this great little feelings activity today. And then also I think, what do I then prep for the next session? Because it may come up again, they may want to continue to process or things like that. So how do I look at what's all set up already? And then how can I shift that to meet their needs?
Yeah. I think that that's an interesting point too about preparation. One is you can't prepare all the time because you never know, as you said earlier, I think what is going to come up, right? You got to be in
Right.
the here and now. You got to be able to pick up on things very quickly. And that's what's so hard about, and things are moving quick in a group, right? There's so much going
Well,
on
yeah.
and to be attuned to, which is why it can also be exhausting after the group, right? You're running this thing and you're like, what? It was only an hour and a half. What's the big deal? Meanwhile, I see five clients back to back and I'm fine. Well, because there's so much to manage.
Right.
I have to see. Okay. Um, so yes, there is a lot going on. And I think, on the other hand, you have to do some preparation when something like that happens to anticipate where do I need to go next time. However, it doesn't mean that people are going to be in the same place the next time. And you have to, again, start where the client is, right? But the client is the
Exactly.
whole group. And so some people might still be back there. Some people might have completely moved on. How do you take into consideration, right, everybody's needs at the same time? It's almost an impossibility. You just do what you do and then see how other people are responding to it.
Exactly. And sometimes too, I love exactly how you said that because, sometimes too with that idea of like if half the group is still in the previous group and the other half is ready to kind of just continue as typical, think about, okay, how could we kind of package up our last group and put it on the shelf, but what does that mean for us as a group? And kind of going with that, before kind of moving forward. Because I always think too around, that idea of like the therapeutic focus, thinking about, um, what is everyone's goals and trying to keep that in mind too.
Well, I think in a way you just kind of made clear why there is a beginning, middle, and end to groups, not only each week, each meeting, right? That there's a beginning. What did you say at the beginning? The check-ins is what you do. The middle is like the meet, and the end is closing out and making sure everybody's okay to kind of leave the room. But then there's also the
Exactly.
beginning, the middle, and the end when you referred to phases of group dynamics, right? So over the course of time, if a group is open-ended and it's going for months and months, if not years, or even a 10-week group, there's a cycle in a sense. Can you talk a little bit more about that cycle of a beginning, a middle, and an end, or the phases that you were referring to?
Yeah, absolutely. It's one of my favorite things to think about, and especially if I connect this back to our beginning part of the discussion, where we think of around how do we just start a group, right? It's something I always talk to group members about throughout the process, from kids to adults. So kids, and especially with kids, right? I like them to be as informed as possible, that we're not just meeting every week doing an activity, but that there's a purpose to it, right? And so in the beginning, we have our forming stage, right? That's where they're getting to build trust, have that structure, right? And, I'll use the example of like a 10-week group to kind of give us that, more real example. Maybe forming is your first and second group. But as you start to move through, maybe three, four, five, and six is around that storming, norming, and performing. And that's where your conflict happens. That's where the cohesion's building. You're thinking about what's the therapeutic work that you're working on, right? That's really like the meat and the essence. And then you also have a journey, right? And that's I would say like particularly 9 and 10, but maybe even it's part of 8, right? Depending on the group, how it's been going, who's part of the group, the dynamics. Maybe you start talking about termination a little bit earlier in that eighth group, just to kind of prep members that they know, hey, this is coming to a close in 2 sessions. In the ninth group, this is ending next session. So that it kind of helps folks work through those phases. And I always think it's really powerful. And I even talk about this to my students because I teach group for our department. And particularly the storming phase is always my favorite because it's something that happens throughout all the groups. It's not just this one session was a storming phase, but how does conflict arise? What's happening? How are they challenging the norms, right? What norms were set? Different things like that. And so that's where, storming, transference, and countertransference kind of is something that's throughout. And then for us as facilitators, how do we facilitate that change and that movement so that you are continually more norming and performing, right? Of being able to do those therapeutic activities, you're deepening the work, you're having that growth, however that looks for each member.
So how did you transition from a CBT DBT type group, which is very structured, to a psychotherapy group that's more unstructured and less planned?
Well, so it's been more so in my experience to use more of like the structured groups. Although when I do think about some of my groups where maybe I called them more skills based, I would say maybe those were more, psychotherapy, where yes, we're using feelings identification, maybe we're doing some coping skill buildings, mindfulness, different things like that. That's where I would say that was more psychotherapy so that folks can talk, but we're also, okay, I'm noticing that there's some change in several of our folks. Maybe let's walk through a breathing exercise as we continue through talking about said topic.
Mm-hmm, mm-hmm.
So I would say, yeah, I guess I would say my skills groups have been more psychotherapy. Because then I'm also thinking, how are we processing that grief? How are we processing, the anger or in the schools, I also did a group that was on students who had recently moved to the United States. And, just providing that space of like the transition and change and things like that. Um, and so again, providing that space to talk, but then also infusing some of those skills, but in a less structured way.
Yeah, so kind of what I hear you saying is that you're always paying attention to the triangle, the emotions, thoughts, feelings. Is that the three N's that you're saying?
Thoughts, feelings, and behavior.
So thoughts, feelings, and behavior, even if you're teaching something, and whether it's a skill, a coping, a technique, that you can't do that without. That's kind of what makes me think. Sorry, I'm just kind of flipping thoughts here about like
Yeah.
the difference between case management and therapy. My social work students often say they want to do therapy, but you can't do therapy without doing some case management. You can't do case management without doing some counseling or therapy, right? There's no matter what, if you're helping somebody link them to resources, how are they going to maintain their stability or those resources unless you understand what keeps getting in the way, right? And that's part of the triangle piece right there. So I liked hearing that you're paying attention to that.
Yeah, Amy, I think around, the parallels between clinical mental health counseling and social work, and oftentimes, there's folks in the field, and in some ways I'm making a generalization, but I feel like I've heard this from so many colleagues at conferences and in the workplace and things like that. And to me, social work and clinical mental health counseling, there's a lot of similarities and overlap. We can't do therapeutic work without also providing case management to our clients at the same time. So it's not like one discipline does this over another, but really, how are we supporting our clients? Because if they need that referral, if they need that program, that resource, all those different supports, that's case management, right? Of giving them a referral and saying, Ray, how did that follow up go with the psychiatrist? Or if you're talking to a group like, oh, there was that community event this weekend. Did anybody have a chance to go? I know several of you talked about some interest and, thinking that it would be really helpful to go to. What was that like, right? So I think in some ways that case management also helps us just making those connections for our clients, whether individually or in group, that really helps. So I think it's not separate, but really just part of that therapeutic process. And something that I talk to my clinicians, my students about all the time, that we're not just sitting in an office for 7-8 hours a day providing therapy, but what's that follow up? Who are the calls? You have the psychiatrist who's calling you to follow up about your client. That's case management, right? Of like giving those reports and all those things. So, I think it's really important for folks to know that it's about communication, collaboration, and that partnership, regardless of our degrees and titles and all of those things, because at the end of the day, we're there for our clients, whether it's individually or in a group setting.
Yeah, I love that distinction. That's not a distinction. It's like we're not distant relatives, we're first cousins. Not only the difference between social work and clinical mental health counselor, but the difference between case management and therapy.
Mm-hmm.
Right? Yeah. So I think that we're more alike than folks think or know. So I really appreciate that. So let's summarize. We talked about how to screen for groups. We talked about how to structure groups, or that we can't always structure groups depending on what kind of group it is. We talked about that idea of having an open agenda. We talked about, support groups to psychotherapy groups, and transferences and countertransferences, that we as the group leaders, have a lot to contend with ourselves, and while we're trying to manage all the individual dynamics within a group and the group dynamic. So there's a lot to consider when you're running a group. It's not just getting a group of people together and saying, let's talk, let's talk about what's going on with you. So thought goes into this. What do you want to leave folks with?
I appreciate that recap so much, because for me, it brings it down to the essence of groups are such a powerful tool. I say this all the time. I'm actually teaching group this semester again, and it was the first words that I said to my students. And I think that, the sentence and the sentiment is there because there's like you just recapped, right? There's so many different pieces that you want to consider, from the group dynamics to your leadership style to facilitation. How did you prep and plan? Did you have time to prep and plan, right? But at the end of the day, the group itself is what leads it, right? So we can do all this planning, we can have our activities, we can create that structure, but I think it's also what's going to happen within that group setting that really gives that essence of the dynamics, what they're going to learn, how they're going to grow, and so on. And so I think it's those two things for us to consider: is we can prep and plan and have that great idea, and we're ready for our group, but also what are they going to bring? Because that's also going to alter how we approach group dynamics, group facilitation, and things like that. And so I think, it's considering how, for we as clinicians, are going to facilitate those groups and participate, but also too thinking around groups within our lives, right? Because groups, we have our family groups, we have our friend groups, you have coworkers, right? You have the meetings that you attend. There's so many different examples in our life that we're a part of groups. And so I think with a lot of what we talked about in the podcast applies to all those settings too. So we can take lessons and pointers and tips and tricks from all these different life examples and then translate that into a therapeutic setting, whether it's a support group, a psychoeducation group, therapeutic, and so on. So it's really just thinking around just how powerful they are. And then for us as facilitators, how do we navigate those dynamics there?
Wow, that's a great summary, and just highlighting the key elements and giving a new practical lens to thinking about just how we all move in groups, right, throughout our lives, from the classroom, being a student, to a professor, to, your community, to your friend group, to your spiritual group, if you have one, and on and on and on. Extracurricular activities, sports, and groups are a major part of us, and paying attention to the dynamics and the many aspects of what that looks like and how we feel in those situations. It's interesting because I know we're supposed to be wrapping up, but I just have another thought, that it's so interesting that we're all, if we're aware of ourselves and how we move through life, and how context is so important to how we function or present ourselves. I mean, some of us are pretty consistent, but some of us, shift based on who we're around and what those other people around us bring out in us. So, once we start paying attention to that, group work becomes fascinating, and how it gets played out in a therapeutic environment. So it's so fun. It's so interesting. I know a lot of people are intimidated by them, because there is a lot to manage, but they're also just fascinating. And like I say about this work in general, think about how much you could learn about yourself by putting yourself in a situation where you're surrounded by folks that you have to be attuned to, and then you get to grow as a luxury as a part of that, because you're learning so much about yourself as you're managing those that you're with. Oh my God, Ray, thank you so much. I so appreciate your expertise on group work. Please come back, and I will talk to you soon.
Thank you so much for having me. It's been a pleasure.